Well, good evening. This is Dr. Ellithorpe, and we are on the TLC Tustin Longevity Center here in Southern California. This is where we meet every Tuesday night at 6 o'clock, and we take your questions. We do them through an email format, or we do them through the live chat on the YouTube. You can, if you're a member, you can get onto the YouTube TLC channel and then type in a live question. We will try and go to live questions first. And then if you are on our newsletter, that's at tlcdoctors.com, then you can type in on the newsletter. We will send you a notification with your email. Give us your email, and then we'll inform you every week to remind you that we're going on air. And then I will get your emails like I do have here. And then we can start with answering questions. This is not meant to be management of disease on the YouTube. Rather, what we're trying to do is just talk about how we would functionally, integratively approach the symptoms or situation that you're talking about in your question. So, no, we're not treating over the internet on YouTube. We are trying to address the thought process that goes into a medical doctor who has many decades of experience with functional, nutritional, interventional medicine to come alongside the standard of care. So, with that, we'll begin with our email questions tonight. Harlow asked the questions. Blessing, Dr. Rita, what do you think of a total cholesterol of 220, triglycerides of 189, LDL 138, HDL 38? And this is in a 70-year-old man. The apparent glucose, hemoglobin A1C are reported as normal along with everything else. So what are my thoughts about this? Well, it'd be interesting to find out what the glucose was if it's fasting, I assume, because what the range is considering normal, very often the lab range will just be a population average, and we all are aware that the population is not a healthy place to compare yourself with, seeing as we have an epidemic of obese newborn babies. We have the highest infant mortality rate in the world for a first world country. We have the highest amount of obesity and teenagers and children with new onset type 2 diabetes. We have the worst chronic disease. It's said that 85% of all disease is lifestyle management, chronic disease. And so I would not want to be compared with a reference range on your lab that is looking at the population. So is this glucose that you were saying just to me is normal? You didn't give me the number. If it's not under 85, then we would consider that a high end for the glucose. And they consider it a normal hemoglobin A1C up to 5.7, and we say 5.2 to 5.3 maximum. Now, the big giveaway here is the triglycerides reported at 189. That no way is normal. And so the population average tolerance is up to 150. But we know that that is in our experience in functional medicine, that's a number associated with ongoing chronic degenerative disease development. We like to see the triglycerides, which come from eating starch and fruit and carbohydrates and refined sugars. That is, if not used and burnt up, it will be processed into a simple fat called a triglyceride. So the end metabolic pathway for unburnt up, unneeded starch and carbohydrates will be to make them as storage fats. And that's how you gain weight and make your fat cells larger and larger. So they say up to 150 would be normal for triglycerides, but we would say we would like the high density lipoprotein, which in his case was 38. We would like that to be nearly equal to the triglyceride. If they were equal, both the triglycerides, and I get my patients easily down to 38, 50s, and their HDLs will even come up, because if you exercise and build up your muscle mass, that will increase your insulin sensitivity. That will help you burn fat. That will help burn down those fatty triglycerides that come from the excess starch, fruit, and carbohydrates that you're eating, and that'll burn it down. So what I think is this gentleman is marching his way to chronic degenerative disease processes in his body, and typically moving towards diabetes, insulin sensitivity, and cardiovascular disease. I would take whatever his fasting blood sugar is, and I would ask them to do a fasting insulin. Anytime you do a fasting lab and you get your glucose, then if you multiply your glucose times your insulin fasting and divide that by 405, you'll get a number that should be 1 or less. That's your HOMA-IR, which is kind of like homeostasis insulin resistance factor. But you don't even need to worry about those calculations. Just ask your doctor to please get a fasting insulin anytime you do your labs. So, Harlow, the thing is, this gentleman has to do weightlifting training if he's able to, and exercise, not eat past 3 in the afternoon, latest 4, be on a lower starch, carb, fruit, nuts, seeds, rice, beans, all those things, and get his triglycerides down to probably 75 to 50 range. And with the exercise, his HDL should come up from 38 to 55. So if you had a triglyceride of 75 and an HDL of 55, that'd be a much healthier picture. If the blood sugar is 85 and the fasting insulin is roughly 4 times 80 would be 360, roughly 400. And if you divide 405 into that, that would be a 1. So that would be the range you would have to do for having healthy parameters. And let's see, some of the live questions are coming in. Christina says, hi, Dr. Rita. Hi, back to you, Christina. Is it okay for someone with liver cirrhosis to take grass-fed beef liver capsules? Sure it is. Absolutely, it's fine. They're very high nutrient dense supplements, and nutrition, healthy, good nutrition, avoiding alcohol, avoiding carbohydrates, high fructose corn syrup will help metabolically support the process to heal that person. So it's very safe. Christina also says, what do you think the best diet would be for the liver? 67-year-old man in liver failure from alcohol. Other organs are fine. Well, I've had many patients over the past 45 years who have had, and family members that had alcoholic cirrhosis of the liver. So the toxin alcohol is able to damage metabolically and then scar, creating what we call cirrhosis, stiffening of the liver. And the liver is usually quite able to repair itself, but when it gets all scarred up like that, the portal venous system, the blood going to it, can get blocked up, and you can get stiffness around the blood vessels, and all sorts of risks for varicose veins in the esophagus and rupture of these, and then a bleed out, because the liver is very important in making your clotting factors. So often a alcoholic will die from a dilated vein in the esophagus region near the liver, where the veins come out because it's all stiff, kind of like varicose veins. and it'll just get scratched or injured, and then they can't clot, and then they die, unfortunately. So, what's a good diet? Um, I would be on a very low sugar, high fructose corn syrup diet, because high fructose corn syrup, fructose is toxic to the liver, just like alcohol. So you would have to avoid all fruit, all juices, all alcohol, and eat largely a grass-fed beef, prairie-raised chicken or something like that, roasted, and then fish, eggs, and give that as breakfast all the way to 3 o'clock, and don't feed them after 3. Elevate the head of their beds, and make sure they drink half their weight in water, and systemic enzymes to help disinflame them. Alpha lipoic acid is very helpful for liver toxicity. Usually we would give like 1,000 milligrams of alpha lipoic acid to our alcoholic cirrhosis, or even the non-alcoholic liver disease from high fructose corn syrup that we're starting to see in adolescents and teenagers just from all the junk food and soda pop they drink. They're literally harming their livers just like an alcoholic. So we would give them alpha lipoic acid, and I would give them, exercise as tolerated, vitamin C. I would give them at least, 4 grams to a day of vitamin C. I would watch their vitamin D level very carefully because the liver is now already injured. So you would have to cautiously dose and then measure the blood vitamin D level to protect them from infection and to help their bones and to help their immune system. So these are the things that we would do, and they would have to be under the care of their hepatologist. There are specialists that do this, and then find a functional doctor that is very familiar with some of these natural things like alpha lipoic and the importance of monitoring the D and the amount given, getting vitamin C because humans don't make any vitamin C, and that helps with the inflammation and the uh, oxidative stress that they're under. They would need a multi-mineral, and they would probably need a digestive enzyme to help them digest the richer fish, chicken, turkey, beef, eggs that they're eating as well. So that would be the way I would start that pathway. Then she says, God bless and thank you. All right, praise the Lord. Garden Fairy says, my 90-year-old mom had increased dizziness, vomiting last Thursday, 4 days in the hospital, orthostatic blood pressures, meaning when she would stand up, her blood pressure would drop. When she would lay, it would probably be more stable. She's off of the metoprolol, which is a blood pressure beta blocker. It lowers the blood pressure and the heart rate, so she's off of that. And she's off of the hydrochlorothiazide now, which is a diuretic, but she is still a bit dizzy. Ideas, she had a normal CT, an MRI, and so it doesn't say what they did, but I would presume they did it of her chest and abdomen, maybe of the brain, to look for any brain cause for dizziness. And I guess her electrolytes, she says, are normal. Well, ideas, I think she was probably over medicated. It's said that about a third, the top third reason, maybe the fourth, for death is caused by doctors or being treated with interventional medicines that are too aggressive. And the older you get, the more risky it gets to be on many medicines. And you have to understand that there are no research studies on what we call polypharmacy. So you're giving a person a diuretic like hydrochlorothiazide, and then you're giving a person a beta blocker, which slows the heart rate down and lowers the blood pressure. Both things can lower the blood pressure. And then let's say they're on a statin which is very common. And then maybe they're on Namenda, something to help with their declining cognitive function. And let's say they're on a baby aspirin. So there is no study out there on a baby aspirin, Namenda for cognitive function, statins, beta blockers, and hydrochlorothiazides, those 5 medicines. So you are a study of one. And the older you are, the higher the risk of having side effects from polypharmacy. And it is too common for physicians to abandon primary care. And instead of knowing their people, knowing their patients for decades and seeing their children grow up and patients get older and aging and watching this, there's just an awareness in a good primary care doctor that when they see a patient of theirs who maybe had seen a heart specialist for maybe a questionable episode of chest pain, and they were evaluated by a cardiologist for this, and they didn't find anything serious, maybe some borderline issues with an echocardiogram or a mitral valve, or borderline issues with plaquing, and they start piling on medicines like a aspirin and then a cholesterol lowering item and maybe a blood pressure medicine, albeit none with any clear-cut serious illness. And then you add the other medicines that came with, maybe thyroid medicine, maybe a antidepressant, or maybe a uh, cognitive enhancing prescription. And these patients come in with piled up drugs. The cardiologist in his realm has done the right thing. And the endocrinologist for the thyroid has done their right thing. And the neurologist for the memory support has done their right prescription. And the, let's say the gastroenterologist has them on some antacid, and he has done the correct thing for their symptoms and mild gastritis at the esophageal gastric junction. So every doctor is malpractice covered and protected by giving the standard of care. But you start seeing 4 or 5 doctors, 6 doctors, and they're doing all their medicine, and the poor patient is coming in with 7, 8, or more medications, and they get these side effects. We need to restore the dignity and the value of a wonderful primary care physician who stays in one place, watches over his flock, and is happy to be loved by them and to love them back and get a decent salary. This is the essence of serving your community. And we have fractionated it into urgent care centers and drop-in medicine, drive-by medicine, emergency room medicine. We have hospitalists now. We don't have your doctor who will come to the hospital anymore and see you there. We've all protected ourselves with layer after layer after layer of protection from personal management of a population of people. Now we have systems managing it, and we have the worst healthcare system in the United States compared to years and years ago. So let's get back the honor and the value of one primary care per 1,000 or 2 patients. So a city of 100,000, or let's say 100,000. Let's say there should be 500 primary care doctors, something like that. All right. Let's see, what else do we have? What I would do also for your mother with those little bit of dizziness is make sure she's drinking enough water and get her to start doing some chair exercises or exercises in the bed, and calisthenics like doing crunches, lifting weights up with her arm, doing wall push-ups, stand up, sit down from the chair, uh, and marching with her legs from the chair up and down, open and close from the chair. Doing all these things will help build up muscle tone and continue with getting some physical therapy for or going with her to the gym 3 times a week on resistance training on the machines only, not free weights, if it's at all possible. All right, Jilly says, I'm interested in your advice to elevate the head of my bed, but cannot figure out how to do it. What do you suggest? Well, if you take rolls of blankets, so you take a blanket and turn it into a roll, and have someone help you lift up your mattress, the head part of it, and you put about 4 or 5 or 6 rolls of blankets in there. That's going to elevate that head of your bed. And the research shows that you have to get it up about 15 degrees, not 45, okay? You want to get it to about 15 degrees to 20 degrees. And so it's not just an inch or two, it's probably more like, getting about from the very head of your bed, getting that thing up about 5 inches, 6 inches. If you can at all get a electric bed where you have with a button, the head raises up and the legs will become bent, so you can bend your knees over it so you don't slide down so much. The other thing is, if you don't get the electric bed, get another big pillow to put underneath your knees so you don't slide down. The research shows this prevents silent reflux of acid that will go up even without you knowing it. The older we all get, the slower we digest our food, the longer it stays in the stomach. And there, when you lay down, it can kind of ooze up your throat without you even knowing it. That is why we say if you're over 60 years old, research is very clear on this, that you should stop eating earlier. And they claim, and the research show, and now that I've been doing it, 3 o'clock is your last meal, and that's it. So I try and eat, if I do eat, everything when I wake up, all the way up to 3 p.m. Often I'll just get one meal in a day. And so I am clearly having less throat and irritation, less postnasal drip irritation by just elevating my bed every night that 15 to 20 degrees. And that is what I suggest you do, is get rolls of blanket and put it under the head of your bed until it's raised about 15 degrees. SBM Jen says, how much vitamin C would help with varicose veins, or what else could I try to get rid of the raised ugly veins? Well, over time, and we're talking years, we can remodel and do some reabsorption. It isn't out of the question that some of these veins can be diminished in their protrusion, but terribly tortuous, dilated, bulbous veins on the skin surface that have had their valves damaged. These are probably not going to change, and you'll have to wear compression socks. The time to start the vitamin C is when you're younger, before they develop. And the vitamin C can help prevent little patches of damages on our blood vessels all throughout our body. But the venous system that is allowed to become bulbous and dilated in the skin region is pretty much a an item that you're going to have to deal with your vascular surgeon. I would still take the vitamin C if they do some vein removal and stripping. You still need vitamin C to prevent the fact that you're someone that probably has had subclinical scurvy that allowed the poor elastin, collagen, and vitamin C helps prevent it from pulling apart under pressure, and minerals. So you need the multi minerals, magnesium and zinc. You need them with eating a rich protein diet and vitamin C to help make strong elastin and collagen that are very rich in a protein rich diet. Uh, Alexander says Katie Couric interviews a neurologist in her YouTube channel that said a study points to lithium deficiency as a cause of dementia. That's correct. And I have had for years and years and years put a small amount of lithium orotate in my multivitamin for that very reason. I'm glad the neurologist is learning about natural ways to help his patients. So I'm very happy to see that occurring. I feel blessed that I had such a good education and training by learning how to study on my own in the right places. I give God the glory. The Holy Spirit led me into all this truth. So I'm in agreement with it. She goes on to say that the lithium is even able to reverse the disease. Still testing. There's also a wonderful body of science on the fact that lithium orotate is very good for bipolar disorder and helps to prevent suicide ideation. And so the studies show when it is supplemented, the incidence of suicide is statistically significantly dropped. So yeah, that's why I've had it in my formulation for decades. SPM Jen says, what's the difference between orthodigestzyme and systemic enzymes? Well, one is to help you to digest your food when you eat it. So it contains primarily betaine hydrochloric acid, which is a acid that's very necessary in the process of digestion. In fact, you have to get your whole pH down in your stomach to kill off bacteria and other pathogens that may be in the food. And this acid kills them off. And so you have to have acid. That's why it's illogical in many ways to take antacids and this terrible decades of use of acid H2 pump inhibitors that have lowered the acidity, but to the detriment of nutrients and absorption, and especially the older you get, it's harder to digest and make these enzymes and acid. So one is a digestive enzyme, helps you digest your food, take it with your food, and it has the acid in it. So it helps with enzymes to digest fats and digest proteins. And there are some enzymes in there that help with digesting carbohydrates, but that's the simplest. And then she goes on to ask, oh, and then the systemic enzymes are what you take on an empty stomach. These are then absorbed through the bowel lining, and they get to all the parts of our body, our sinuses and tiny irritations and tiny damaged cellular debris throughout all your body, throughout all your life. We have a rich abundance of systemic enzymes when we're younger. That's why we heal so quickly. That's why our bruises clean up so fast and so quickly. And we lose the ability to make that protein enzyme as we age, and then debris builds up. We get dirty and dusty inside, inflamed is another way to say it. We start to ache. We don't drink enough water typically as we get older, and it's a pathway to our damaged joints, damaged blood vessels, damaged skin, everything. So one is for the systemic body to get rid of debris and old cells so the new one can emerge, and the other digestive enzyme is for your food. And then she went on to say, and when should they be taken? Of course, orthodigestive enzyme when you're eating. For A type blood and O type blood also. Thank you, Dr. E. Well, A type blood has a classical history as a group of making much less stomach acid and enzyme compared to the typical blood group O that makes typically the highest amount of stomach enzyme and acid. But all of us, even the O type bloods over time, when they hit their 60s, 70s, their digestion drops off dramatically too, and they also will have to take digestive enzymes with betaine hydrochloric acid. But A-type blood people have to use this very early in their life, even as children, adolescents, all the way through their life. Otherwise, they won't digest their food well. They'll learn to not want to eat healthy, necessary fats that are rich in animal things like chicken with the skin, the beef, grass fed, wild caught fish. And they'll be looking for plant sources, which are always inferior nutritionally. And the volume that you have to eat will generally create such a higher carbohydrate consumption in the diet for the person who does this. They have a higher risk of trouble with keeping their insulin sensitivity, their blood sugars under control, and all those damages from a higher starch, carbohydrate, fruit sugar lifestyle. Uh, let's see, what's the next question? Cindy says, Dr. Rita, my husband took a blood test and found out that he has high LDL. There is just so much coming out in the past 10, 20 years on LDL not being important. And his lipoprotein, I assume little a, is high due to genetics. What would you recommend for him to do, and how can he lower those levels? Well, I don't care about his LDL. I only care about his triglyceride that comes from the starch, fruit sugar, carbohydrates, grains, fruit, bagels, nuts, seeds, crackers, all those plant foods. And I want triglycerides to be 75 or less, preferably 50, 55 range. And I would recommend doing weightlifting 3 times a week, build up the engine of your muscles to burn down what carbohydrates or starch you do get from the more complex carbohydrates. And then I would take vitamin C. I would take a gram or 2 of vitamin C 2 or 3 times a day. There's, I remember the name now, I think it was 2 videos 2 weeks ago. One article, or it's a YouTube. So the name of the YouTube is Physionics, Physionics, Physionics. And the gentleman there is a young man, PhD, I think in biochemistry, and his father's a physicist. Anyway, so the new young man with his PhD is doing a wonderful job looking at research and very often on health. And one of the things he comments on is the fact that no one ever tests lipoprotein little a as a general rule, because there's really nothing you can do to lower it. And that's why they call it genetic. And maybe a third of the population has that problem. And there is a YouTube where in Physionics, if you see it and you put lipoprotein and then a parentheses with a little a and another parentheses, then and the word vitamin C, you'll see his couple of videos on it. A second wonderful YouTube young male PhD also talks about this, and his name is Nick Nikowitz, Nicowitz, Nikowitz. And he does the same thing on lipoprotein little a, and both of them talk about LDL as not really being validated as a predictor of heart disease. And they go into great depths, both of them, about all animals can make vitamin C, all of them, except for maybe the guinea pig. And they're going to believe that this is an evolutionary fact to help with preventing clotting and so forth during stress. As you become focused on the human being, we don't make any vitamin C. Some babies as newborns do make it. So there is enzyme in the four pathway series that produces vitamin C. We don't have the last enzyme to convert glucose into vitamin C, but animals can convert all their starch and sugars into vitamin C. So that enzymatic pathway that prevents that is associated with lipoprotein little a production, which functions to help promote blood clotting. And this blood clotting will help prevent micro trauma damage throughout the body and larger cuts and bleeds. So it's believed that since the human cannot make vitamin C, and if you're low in vitamin C, you will bleed to death. You'll get that your gums will bleed, your teeth will fall out, and you'll get that vascular bleeding. So instead, we make lipoprotein little a to help us replace what vitamin C we cannot make. But if you take vitamin C, you'll find that that truly will lower the lipoprotein little a. However, vitamin C does so many things that are cardiovascularly beneficial to prevent endothelial cell membranes that line the blood vessels from damage and help engender more glutathione with vitamin E. So it's in an entire symphony of work that helps us stay healthier, younger, longer, better tissues, better collagen, less wrinkling, less cataracts, all these wonderful things. So I would take vitamin C 1 or 2 grams twice a day, at least, if not 6. Linus Pauling took 6 grams a day with his wife, and he was mentally functional and very healthy. He died at 96, I think he was. Hopefully that helps you. Okay, so don't worry about his LDL. In fact, research will show if you did a highly scientific study focused just on a blood panel on the lipid profile, it's got various names. You fractionate the LDL and you look at it as a big LDL, a small LDL. If you have big, fluffy LDL, that's associated with low risk for heart disease. And very often, people who are on a nice, low ketogenic diet, they have higher LDL cholesterols. Now, their triglycerides will be in the 50 to 75 range. Their HDL, because if they're healthy, conscious enough to eat a low carb diet and not eat late and exercise, then their HDL will be up probably around 55 to 75. Those are all predictive of very good health, heart, and low risk for heart disease. But another thing very important about LDL cholesterol, because I say God doesn't make anything unnecessary, and LDL is very important in being a antioxidant garbage container for endotoxins. So your bacteria in your gut can sometimes produce toxins. And if they do, LDL will snarf it up and kind of process it away from the body from doing cell damage. So your immune system is very important, and LDL levels are important in a very healthy adult. And as we get older, you'll find that people are predicted to live longer if their cholesterols are above 200, which means their LDL will likely also be higher. And that means they'll have a better, healthier immune system. So many things go together. Cindy Love went on to say his triglyceride level was 59. That's very good then. And his LDL cholesterol was calculated at 126. That's not high to me. That's not high at all. So I'm very happy with those numbers. Remember, we have to exercise and we have to do weight training 3 times a week. We have to stop eating late, dinner time. I ask my patients to try and turn dinner time into project time, getting something done, having a family meeting, accomplishing things together, rather than looking at trying to take the time to make dishes and eat and then wash the dishes and consume 1 or 2 hours of time that could have been projects. Set up your slow cooker so that it slow cooks throughout the night from 10 to 5 a.m. And then you'll have a nice falling apart chicken roast or beef roast or pork tenderloin roast, and that'll last you a couple of days, and it'll smell up your home with healthy homemade foods, and you'll get all that rich protein, collagen, minerals, and take it to work with you. Eat it for your lunch, and you'll have had good full food, and then you'll be ready to get some projects done in the evening. Okay, so what is benfotiamine? Benfotiamine. I'm not sure. I'm going to have to look that up myself. Benfotiamine. Benfotiame. Sounds familiar, but at the end of the workday, in this 72-year-old brain, I'm just not thinking about or remembering that much. Sorry about that, man. I'll get to it next time. Alessander says, how much lithium orotate is in your multivitamin? 5 milligrams. So it's a very low dose, but it's the range that was found effective and valuable in the body of science for mood disorders, bipolar, and suicidal ideation. And what's the name of my multivitamin? The name is called Energy Core. And we put that together with our team, not Orthomolecular. Who makes it for me? We have a private nutrient producer for a few select items, and that's one of them they do for us. And so, I've had it for decades, and it's served us very, very well. B1. Oh, okay. Thank you, Mano. It is vitamin B1. There you go. Yes, benfotiamine. Okay, vitamin B1. And so that is usually underrated and underdosed. We usually like to see thiamine given at 50 milligrams, 100 milligrams, and most multivitamins are woefully low in that. So, indeed, a lot of mood disorders, a lot of mental disease. Remember beriberi, dementia, diarrhea, and dermatitis. These were B vitamin deficiencies. And what's another vitamin deficiency disease? Well, vitamin C and scurvy with the bleeding we were talking about. But we very often are not appreciating what industrialized farming has done and how it's raped the quality of our food. So the 1950s apple and avocado are so much more nutrient dense from the soil than and from the sun, because we have chemtrails now and that heavy metal toxin and the glyphosates and all of that being sucked up into your plants. So it's a difficult thing. Okay. Cindy Love says, how dangerous is a large subchorionic hematoma in pregnancy? Does it go away on its own? Well, it's concerning, and yes, it can be reabsorbed. We are always remodeling and resorbing these things. So you would have to continue to get the ultrasounds to track that, and be mindful to tell whoever the patient is that has that to stay away from aspirins and Motrin, anything that would thin the blood unnecessarily, to be closely followed for that. Yeah. So we normally reabsorb these things. Just the same thing when we see the placenta, which is low, we call it placenta previa, where it's covering up the cervix, where it's going to have to open up eventually for the baby to pass out. But usually over time, the placenta very often will move up with a growth and formation and of the pregnancy. The same for the subchorionic hematomas. They very often should heal nicely. All right, let's go to another one of our email questions. It said, a friend of mine, her daughter was diagnosed with a thyroid problem, Hashimoto's. That's the name of the doctor who identified autoantibody attack of the thyroid. and his name was Dr. Hashimoto, and he described autoimmune thyroiditis. Her doctor prescribed levothyroxine. That's a T4, a precursor thyroid, which has to be deiodinated in order to convert it into the active thyroid hormone T3, and then you get the function of it. Is this the best way to treat? Well, Marianne, my experience over many decades is autoimmune phenomena that attacks the thyroid is a gut problem, from leaky gut, digestion, the damage that we've done in the food industry, the dyes, the genetic modification, the pesticide, glyphosates, all these things. And we have sensitized our immune system because 80% roughly of our immune system lines up from our adenoids all the way down through our gastrointestinal tract. And those micro damages get amplified, and your body will have what we call molecular mimicry. And it will look so similar to like the thyroid peroxidase or the thyroglobulin, different regions of the thyroid tissues, that it can make antibodies to them. So it's very common. The other common thing is to the cartilage, getting joint breakdown, rheumatoid arthritis. Another area that is molecularly mimicked is the sheath myelin covering the nerves, and you'll get neuropathies, and these will be associated with multiple sclerosis, Lou Gehrig's disease, and so forth. So, yeah, it is a concern. Now, that's standard of care to give her thyroid, because once you have the inflammation of the itis means inflammation, something attacked the thyroid gland, it's inflamed itis, thyroiditis. Now, that calms down usually, it isn't continuous, and then you become under functioning, and that's why they have to give you the thyroid prescription. So it's not really treating anything about the thyroiditis original cause. It's treating the damage and the lack of function of the gland. So a functional doctor would put the person on, a probably a carnivore diet for about 4 months to replace all the fat and protein, phospholipids, and such that repair the lining of the gut. And then the body will, tracking in blood testing and doing a complete digestive stool analysis, they will track the autoimmune antibodies for thyroglobulin and thyroid peroxidase antibodies. And we see it come down all the time. As soon as they go on a carnivore diet for, several months and don't cheat, because you can't say you were a carnivore and then have cheats all the time, twice a week or something like that. It's not what will solve it. You have to be carnivore, but it always works. So then maybe she won't even need as much, or maybe she could use a more robust natural glandular type called NP thyroid, WP thyroid, nature thyroid, Armour thyroid, and that has a actual typical a smorgasbord of all the thyroid nutrients it needs. It's got the T1, T2, T3, which is the actual real thyroid, and then the T4 in it. So hopefully that'll help you. Maybe you can find a good family doctor that is functionally minded, or a functional medicine integrative doctor, and they'll help you through that pathway. Yvonne says, in the recent Women's Health Initiative, there is an article identifying the relationship between aging using a data-driven method called copulographic modeling. That's a type of statistical and graphing modeling, where you can take a plane and then you can make it 3D with bumps in it, like hills kind of modeling. This is called graphic modeling. They found that certain foods were linked to faster aging, like, and here's the list: eggs, no way; Organ meats, I don't believe it. Sausage, cheese, legumes, I can believe that. Starchy vegetables, I can believe that. Added sugar, I believe that. And lunch meats, I believe that because of all the processing. What are your thoughts on eggs? Um, I'm all for pasture raised eggs, not this terrorized hen farms that produce these kind of pale looking eggs, um, where they can walk on the grass and get grubs and worms and insects on their own instead of the feed that they're given that's got antibiotics and all kinds of other materials and the lack of ultraviolet light from the sun and normal living experiences with hormonal impacts on the development of the um, nutrients that go into making the egg. So, no, I am not at all agreeing that the concept that eggs would be a problem, uh, organ meats, sausage, cheese. No, I would not. Now, if these are from, if you're talking about organ meats from steers, cows that have been sent to the processing yards for weeks or months and fattened up and put on antibiotics and hormones, and then they become starchy fat grains from the glyphosate treated grains. They're getting harmed, so they're not the real meat that you think is good. So that's why I only go for grass fed beef, prairie raised poultry and their eggs. And other farm products, wild caught fish, and so forth, because they are truly as far away as you can get them from the pollutants. Now, they are going to be exposed to drift. I mean, I'm sure a plume of um, pesticide, herbicide, fungicides are there damaging and drifting in the wind. And I'm sure that the chemtrails and heavy metals land on the ground. So some of the grass the cows are eating has too much aluminum oxides, strontium oxides, and barium oxides in it. But for the most part, the direct volume of actively giving them tons of oats with glyphosate in it has been interdicted. So much of science has to be understood. You have to remember that um, the honest and well trained clinician knows, and I think many times they'll get this a lecture in their first weeks of medical school. I did back in the 1970s. You know, half of what you're being taught, we will discover in the next 50 years is wrong. So, what a thing to hear that what you're grueling over and reading in textbooks and grinding away at, you're going to find has probably been overruled 50 years from now. But then on top of that, you learn about the sinful nature of man and woman, and we start seeing them for money's sake, start doing science that only benefits a certain trend of outcome to make their financiers of their university and their grants go in a way that's favorable to the donors. Now, this is not science. And so, what you will hear in your best journals, like the New England Journal of Medicine uh, uh, and Dr. Engel, Angel, Marcia Engel, was the chief editor, I think, from something like 1996 to 2006. Her husband was the chief editor before that for 20 years, and her parting editorial statement in the New England Journal of Medicine said, "I'm sorry to say as I depart that more than half of all the scientific articles that we have published are corrupted, bad science influenced by finances." And I read that many decades ago. And I knew this beforehand because my dad was in food research. So I have a guarded way of looking at science, or those who are on the YouTube, Instagram, saying there's a great new finding. and they know the trigger points to tell you, for instance, corrupt big pharma, because it's even into the alternative world now. They're going to sell you anything. They're going to use a uh, famous person, a movie actor. They're going to even use godly church-like words. He's a known Christian actor is claiming X, Y, and Z, as if they are capable. What has taken me, 45 years of practicing medicine and 10 or 12 years post high school of postgraduate education to just get a grasp of. And you're going to ask me to believe former movie stars and martial arts specialists telling me the best foods to eat and the best nutrient plan if you just find out whether you're plan 1, 2, or 3 metabolic pathways. It is sad. It is sad because I think most of these actors are good people, sincere, but God only knows as you get older and you can't do the acting or the kung fu fighting that you used to do. Being offered money to do a commercial on a nutrient seems harmless enough, but in the world, I cannot just imagine how, I'm not going to say who it is, but they turn down various options for drinking dairy milk or soy milk, and they go for oat milk. And they have no idea the amount of glyphosate and stuff that's going to be consumed in that product. And I'm just sitting there shaking my head on these infomercials. That's why I try to be here every week, to be a sounding board for you and to give you some help in understanding. You have to, at some point, take responsibility for your choices in this life, and understand you're not going to be perfect, but you're going to be doing more good by eating less processed food, drinking more water, and not eating as late, and doing weightlifting, exercise, and some walking. I mean, those are principles that have to be understood. And if you can stay away from a high carb diet, turning food into smoothies, which just makes them much more higher sugar glycemic value, even though maybe originally the food itself was benign. Now you've pulverized it into a much higher sugar, and then you're repetitiously eating the same thing over and over by habit. This becomes very dangerous and very immune frightening to your whole immune system lining. That's why we say eat real food and stay away from any of these cheap bars as a constant daily protein bar fall back on, and suddenly you're eating 12 a week. No way, you shouldn't be doing that. So we're all fighting this. Okay, let me try and get another question in. Let's see. I have dry macular degeneration. The retina specialist is recommending a shot in the eye once a month. So, and that's for the rest of his life, he says. It's not meant to cure it, but it's just to slow the progression. What do you think? Well, I think it's, it's unfortunately a biased system. We have people who actually have improved vision when they do EDTA, intravenous chelation with vitamin C. This improves the microcirculation, improves the nitric oxide production, and the grids that they test them on actually improve in their ability to see and identify activities. So I'm not saying that you can't use atorvastatin. I'm just saying, why don't they know of this? It helps every single person I've used over the decades. So uh, my older macular degenerative patients were up to 3 times a week getting the shot in her eye. And then she dropped to twice a week, and then to once a week, and then to twice a month, and then once a month, and then once every 3 months. And her ophthalmologist, do you think they ever called me? Do you think they ever called me to ask me, what are you doing? Well, this has been going on for years and years and years and years. And now I think she's hitting 90, and they still can't believe her vision is as preserved as it is. And for the first time, she told me, I saw her recently, that her ophthalmologist is now going to start looking into, after decades, and how many patients, EDTA chelation that's been around for 70 years, safe enough to give to little children, toddlers. But don't call another doctor. All right, don't look into it because it's in the internet on the American College for the Advancement of Medicine. So this is what we're fighting, folks, and just have hope. Keep on doing what's right, and eventually, maybe even these doctors will wake up. And then there's a question that says, uh, do you know what percent of supplements are made in the USA? Could there be funding of research and long-term benefits studies done in the USA for USA supplement manufacturers? Absolutely, ma'am. But the cost of this is astronomical. Part of the reason I live such a modest lifestyle is I have put everything I financially can into doing my own research, flying out to companies, looking at their assays and samplings and sourcing. Because as a trained analytical chemist, I just did not trust the system. And there is so much corruption from abroad. Even the containers, maybe the top 2 inches will have the high quality product, but the bottom 7, 8, 10 inches are full of junk material. So you have to know the depth of the sampling in order to get a real understanding if you're getting quality. And then there's no EPA requirements on lead and stuff over in China. They just crank out uh, polluted products. Most of their herbs from China have lead toxicity exposure from all the lead they pump out of their cold plants without any EPA protection. And here in America, we have higher costs because we have removed that and so forth. So, yeah, we need to develop that. So, you solve that problem and help them develop teams that'll do that and get a hold of our HHS to demand that. All right, so it looks like I'm after 7 o'clock and I didn't get to the last few questions, but I will. And I got all these questions here on the live. So I'll say, if it's been of value to you, please like, please subscribe, and hit the like button. Share this with a friend if you find some value in this. And I'll see you next week at 7 o'clock, 6 o'clock to 7, Tuesday nights here at Tustin Longevity Center. All right, the Lord bless and keep us all and love each other, forgive each other. Okay, bye bye.